Prazosin HCL 1 mg. Prazosin is used with or without other medications to treat high blood pressure. Lowering high blood pressure helps prevent strokes, heart attacks, and kidney problems. Prazosin belongs to a class of medications called alpha blockers. It works by relaxing and widening blood vessels so blood can flow more easily. Side effects: headache, drowsiness, tiredness, weakness, blurred vision, nausea, vomiting, diarrhea, or constipation may occur as your body adjusts to the medication. If any of these effects persist or worsen, tell your doctor or pharmacist promptly. Lightheadedness or dizziness upon standing may also occur, especially after the first dose and shortly after taking a dose of the drug during the first week of treatment to reduce the risk of dizziness and fainting. Get up slowly when rising from a seated or lying position. If dizziness occurs, sit or lie down right away. Your dose may need to be adjusted. Remember that your doctor has prescribed this medication because he or she has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Tell your doctor right away if any of these unlikely but serious side effects occur: pounding heartbeat, fainting, frequent urination, mental mood changes, such as depression, swelling of the feet, ankles. For males, in the very unlikely event you have a painful, prolonged erection lasting more than 4 hours, stop using this drug and seek immediate medical attention, or permanent problems could occur. A very serious allergic reaction to this drug is rare. However, seek immediate medical attention if you notice any symptoms of a serious allergic reaction, including rash, itching, swelling, especially of the face, tongue, throat, severe dizziness, trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. Precautions: before taking Prazosin, tell your doctor or pharmacist if you are allergic to it or to other alpha blockers such as doxazosin, Prazosin, or if you have any other allergies. This product may contain inactive ingredients, which can cause allergic reactions or other problems. Talk to your pharmacist for more details. Before using this medication, tell your doctor or pharmacist your medical history, especially of heart problems, such as low blood pressure, kidney disease, uncontrolled attacks of deep sleep, narcolepsy, prostate cancer, certain eye problems, cataracts, glaucoma. This drug may make you dizzy or drowsy or blur your vision. Alcohol or marijuana, cannabis, can make you more dizzy or drowsy. Do not drive, use machinery, or do anything that needs alertness or clear vision until you can do it safely. Do not drive or participate in hazardous activities for 24 hours after your first dose, any increase in your dosage, or restarting treatment. If your doctor prescribes any additional blood pressure drugs, avoid driving and hazardous activities for 24 hours after your first dose of the new medication. Limit alcoholic beverages. Talk to your doctor if you are using marijuana, cannabis, to reduce the risk of dizziness and fainting. Be careful when standing for long periods. Avoid getting overheated during exercise and hot weather when first starting this drug. Avoid situations where you may be injured if you faint. Before having surgery, including cataract, glaucoma, eye surgery, tell your doctor or dentist if you are taking or have ever taken this medication, and about all the other products you use, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of this drug, especially dizziness and fainting. These side effects can increase the risk of falling. During pregnancy, this medication should be used only when clearly needed. Discuss the risks and benefits with your doctor. Size 8 mm x 3 mm. click subscribe to Users Productions YouTube channel.